cranial bones. The occipital bone is the more posterior bone. So here we're looking at another inverted view of the skull, where this is the left side of the skull and this is the right side of the skull, so right side features. Now, the occipital bone is going to articulate with parietal bones at the lambdoid suture, as well as the temporal bones posteriorly. So it's going to help to form that shared canal that we talked about earlier with the temporal bone, the jugular canal, right, which we can see here. We also want to think about other landmarks that are unique to the occipital bone. So foramen magnum, the large opening, in fact, the largest opening in the skull is where the spinal cord is starting from the brain and descending through the vertebral column. And so that is foramen magnum. We also have the occipital condyles. This is where we form the atlanto-occipital joint, the joint between the atlas bone, which is the first vertebra C1, and the occipital bone of the skull. So that very important joint between the skull itself and the rest of the axial skeleton is formed by the occipital condyles, okay? And a condyle is really any cartilage-lined surface where two bones meet. Now we have the hypoglossal canal and the foramen that's medial to the occipital condyles. So the hypoglossal canal is sort of right in between the occipital condyles. And this is going to allow some other vascular structures, but the hypoglossal nerve, which is coming from the C1 cervical nerves. So the hypoglossal canal, the occipital condyles, foramen magnum are some of the features we can see here. Let's look more internally at the sphenoid bone. Now, the sphenoid bone is really one of the most central located bones, and it is interesting and unique because it connects to all of the other bones. It has some attachment point to all the other bones. And it really helps to form the majority of the orbit posteriorly. Some of the landmarks that we have here, the sella turcica or the hypophyseal fossa. This is the groove that is created. It's a depression in the top of the sphenoid bone for the pituitary gland, one of the endocrine glands that is descending or dangling down from the hypothalamus of the brain, all right? So that is the groove called the sella turcica, which literally means Turkish seat, and that is for the pituitary gland. We also can divide the sphenoid into the greater wing, which is found sort of beneath this arch point, the greater wing, and it's larger, versus the lesser wing found above and somewhat smaller, more anterior. So the greater wing of the sphenoid and the lesser wing of the sphenoid. And so it gives the sphenoid this sort of arch-like shape, which gives it its butterfly shape appearance. And so sometimes that may be a description you hear of the sphenoid bone, a butterfly-shaped bone. Other landmarks, mostly foramen that are found in the sphenoid bone, are really important for some of the cranial nerves and some other vascular structures to pass through. So first is the foramen spinosum, and this is going to be the most lateral and posterior in the series of these three foramina that are sort of in this row. So foramen spinosum is the smallest, hence the term spinosum, and it's very tiny. It's a very, very small, narrow opening, sort of a pointed opening as well. Then foramen ovale, so kind of as the name would suggest, it has more of an oval shape, and it's more anterior, more medial within the sphenoid bone. And then we have foramen lacerum. This is more internal, okay? So it's going to be the most medial of these three. And then we have the foramen rotundum. Now, foramen rotundum is really difficult to see in this view. It's going to be the most anterior, sort of nestled within the greater wing of the sphenoid bone. Okay, I don't have another view with it, but foramen rotundum is going to be the most anterior and the most medial in that series of three. So you can sort of see it on this area over here. So rotundum, which is really meaning rounded or round opening, is going to be the most round in terms of its shape as well. So spinosum, ovale, rotundum, and then lacerum being more medial. Now, the maxillary nerve and artery are actually going to pass through the foramen rotundum, so that's another sort of unique way to remember it, apart from its shape and location. Let's look at some of the other anterior structures that we can see in the sphenoid bone. So the orbit, really importantly, is formed by the sphenoid partially, the optic canal. We can see passing through where the optic nerve will pass from the eyeball itself towards its attachment in the brain. And then the superior orbital fissure and the inferior orbital fissures can also be seen as these slant-like openings that are found posteriorly. So the optic foramen or canal, and then the fissure itself being more of a slanted projection where other structures will pass through. Okay. Other structures. So again, looking at an inverted view of the sphenoid bone, we have some other projections inferiorly. These are the pterygoid processes. So the pterygoid processes are collectively formed by the medial and lateral plates. Medial plate and lateral plate on the left and right. So this would be the right lateral plate, right medial plate, left medial plate, left lateral plate. And together they collectively form the pterygoid processes. And these are going to be the attachment points also for muscles of mastication, very similar to what we saw with the styloid process of the temporal bone. So they help to anchor some of those muscles that move the temporomandibular joint and the mouth. Let's look at the ethmoid bone. So the ethmoid bone is going to be more anterior. It is nestled in between the sphenoid bone and the frontal bone. And it's going to have some important features, especially as it pertains to olfaction and the olfactory nerve, which is passing through that area. So it's the area between the nasal cavity and the orbit. And if you look at some of those openings, the cribriform plate, the cribriform plate is the top part of the ethmoid bone. And in it, we're going to find these tiny openings that allow the fibers of the olfactory nerve to dangle down into the nasal cavity. So the cribriform plate has this perforated appearance, but it is running atop horizontally on the ethmoid bone and allows the fibers to dangle down. Then we have the crista galli, and the crista galli is the upward projection. So again, just to give us perspective here, this is a superior view looking down into a cut surface of the skull. So here we can see the top of the calvarium and the top of the ethmoid bone. So this cribriform plate is running horizontally, whereas the ethmoid bone, the crista galli is going to be a perpendicular upward projection into the calvarium. All right. So those two are going to be important. The cribriform plate is actually going to be, again, the crista galli is going to be the attachment for the meninges. So the dural reflections, the meninges that are going to be protecting the brain, the sort of outer fibrous coverings, are going to be anchored at the crista galli that sort of sticks up. And crista galli literally translates to rooster's comb, which is very similar to the way it sticks up from the cribriform plate. Other interesting projections that we can find are the perpendicular plate. This goes right down and is continuous with the nasal septum. So the perpendicular plate divides the top of the ethmoid bone, and the continuation of that is what forms the nasal septum. Now that is going to help separate the nostrils and the left and right nasal cavity. We also want to think about the concha. So the superior nasal concha, and then we have the middle nasal concha are going to be features found in the ethmoid bone, while the inferior nasal concha is going to be a separate bone of its own. So it's not going to be a feature of the ethmoid bone. So here we have the superior nasal concha and then the middle nasal concha. All right. Whereas inferior nasal concha, the lowest concha, is going to be separate. Okay, so we'll look at the inferior nasal concha here, a separate bone of its own. And it's a third of these three bulges in the bones, the lateral aspect of the nasal cavity. And it really helps to form kind of a wind turbinate to kind of circulate air that is coming in and create resonance to the voice and sometimes lighten the head in a way that the sinuses do as well. So that would be what these bones do. But think about how the anatomy differs in terms of the ethmoid bone versus the inferior concha. Let's look at the 14 facial bones. So we just talked about these skull bones. Let's shift gears here and look at the facial bones themselves. These support the soft tissue structures of the face, the muscles, the skin, the other tendons and connective tissue. And so it's really important to think about how they articulate to form structures like the orbit, the jaw, the nasal cavity, the oral cavity, et cetera, et cetera. They're also important in terms of forming an attachment for the muscles of facial expression. So muscles that give the face character and allow us to make certain movements and expression are going to be anchored to these bones as well. Except for the mandible, all of the other bones are going to be somewhere attached to the cranial bones themselves. That is the ethmoid bone, the sphenoid bone, temporal bone, frontal, etc. The nasal bones are going to be projecting to form the bridge of the nose. So these are our first period of facial bones. These are together forming only the bridge. The rest of the nose is actually formed by cartilage, connective tissue, mucous membranes that actually projects out from the face. But the bridge is formed by the paired nasal bones. We also want to think about the alveoli of the mandible. So the mandible being the lower part of the oral cavity, the jaw, it's going to have the inferior alveoli, which are the tooth sockets where the teeth are sort of secured into the oral cavity. And then the infraorbital foramen is going to be another feature that we find in the maxilla. Excuse me. Wait, hang on. Let me rephrase that. We're looking at the maxillary bones, not the mandible. So the maxillary bones are the paired bones that form the top of the oral cavity. So let me rephrase that. The maxilla forms the top or the top alveoli or tooth socket. The mandible forms the lower alveoli or tooth socket. Now, looking at the maxilla, which are paired bones, as apart from the mandible, which is a singular bone, the maxilla has the inferior orbital foramen, right? So again, paired on either side and also found below the orbit. And that can be compared to the supraorbital foramen, which we talked about in the frontal bone. All right. Let's look at other features that can be seen inferiorly in the maxilla bone. So we have the maxilla forming attachments with the palate. So the palate is formed partially by the palatine process. The palatine process, which are connected on both sides, helps to form the front of the palate, the hard palate or the bony palate. And then the back part of the palate here is continued by the paired palatine bone. So we'll talk about those coming up as they are separate bones. Other features here would be the incisive foramen. The incisive foramen allows for certain nerves, like the alveolar nerve, which gives the innervation. This is actually what your dentist will numb when you are having sort of a dental procedure done. And that nerve passes through the incisive foramen to actually supply the gums and teeth. So that would be a foramen found anterior within the palate, which is the fused palatine processes. And that is also right behind the incisor teeth, which are the front teeth. Let's look at the zygomatic bone. So we talked about these earlier briefly when we talked about the zygomatic arch. These have one feature, the temporal process, which is helping to form the zygomatic arch. So remember, the zygomatic process is found in the temporal bone, and the temporal process is found in the zygomatic bone, and together they form the zygomatic arch. And this is essentially the cheekbone region, so the outer lateral part of the face, which again can really be injured with blows to the face or any sort of external injury to the head as well. Looking at the mandible, so now we've gotten down to the mandible, okay? So the mandible being the lower part of the face, the lower part of the jaw, and we looked at its articulation in the mandibular fossa. If you remember us looking at that depression in the temporal bone, which is where the mandible forms the temporomandibular joint. Other features unique to the mandible would be the ramus of the mandible, which is this entire lateral edge of the mandible that really forms the jawline in terms of surface anatomy. So the ramus of the mandible. The coronoid process, which is the anterior projection. So there are two upper lateral projections on the mandible. The anterior one is the coronoid process. And then the pterygoid process would be the posterior or a larger one. But this is also forming the neck of the mandible and the head of the mandible. Okay. So those two projections sort of stick up from the top of the mandible. Openings that we find in the mandible would be the mental foramen. This is a passageway for the mental nerves and blood vessels. The mental foramen being lower to the alveoli or lower to the tooth sockets, which are also found in the mandible. So just looking over again at that description between the lower alveoli being in the mandible and the upper alveoli being in the maxilla, which are fused or shared, right here. Other things are landmarks in the mandible, again, the coronoid process versus the condylar process. Here we're going to find the head and neck of the mandible, right? So the condylar process being the more posterior or superior, and the coronoid process being the more anterior. We also want to think about where the mandible takes the turn, right? Where that jawline takes this turn, forming the angle of the mandible. This is where we go from the ramus to the body of the mandible. We also have internally the mandibular foramen. So the mandibular foramen is an internal opening where the mandibular vessels and structures pass. And then the mandibular notch being the groove that's found in between the condylar posteriorly and the coronoid process anteriorly. So that depression, which is really what helps to secure the temporomandibular joint and allow for the movements possible with mastication, would be the mandibular notch. All right, let's look at the lacrimal bones. So the lacrimal bones are also paired. They're found anterior and medial to the ethmoid bones and the orbit. So within the orbit, so notice how we've talked about several different bones forming different aspects of the orbit. The frontal bone forming the superior aspect, the zygomatic bone forming the lateral aspect, part of the maxilla forming the medial wall or the medial aspect. And then internally, we've got the ethmoid bone forming the posterior medial wall and the lacrimal bone forming the anterior medial wall. All right. And this is really a tiny passageway for the lacrimal duct. And the nasolacrimal duct is what allows our tears to drain down into the nasal cavity. So if you've ever been crying and you sort of get snuffly, that is the duct, the passageway that allows us to drain tears into the oral cavity. So that is formed by the lacrimal bones. Now, looking at the palatine bones, the rest of the hard palate. So the anterior part of the hard palate formed by the palatine processes of the maxilla superiorly, and then the back of the palate, the continuation posteriorly of the palate, is formed by the paired palatine bones. Okay. And then we want to think about the vomer. The vomer is the posterior projection. So the vomer is another bone that also helps to form the separation of the nasal septum. So it's formed partially by that perpendicular plate we talked about, with which is part of the ethmoid bone, and then partially by the vomer, which is the lower part of that separation to form the septum, dividing the nasal cavities. So this is the singular bone that is found sort of posterior and deep to the palatine bones.